Now that we're right dot on the hour, I want to welcome you all to our Preventing the Spread of Infectious Diseases on Farms, Ranches, and Ag Workplaces webinar. I have an amazing guest speaker here, Ellen Duysen. I am Salah Isa, by the way. I'm co-hosting this Cultivating Caution series with the farmdoc team, so you'll see me often. But we have a great speaker here. She grew up on a farm, had to deal with livestock, and then worked as a biochemist for a while before coming back to give a lot of that knowledge that she has grown with and lived with on ag safety and health, and that's what she's been doing at the CS Cash, the Central States Center for Ag Safety and Health. And Ellen, it's all yours.
Oh, well, thank you. Thanks for the nice introduction. And boy, amazing, huh? I've got a lot to live up to here. And I want to thank FarmDoc and Salah for the opportunity to come and talk about a pretty important topic today. Something that maybe, a lot of times, a lot of the presentations we do may be on more injury type prevention in agriculture, something where you see the effect right away. And what we're talking about today is more, maybe even some of it may happen immediately. Some of this infectious disease may affect you, but some of this may also be something long-term and chronic. So it is important to remember not everything that can harm us is going to be noticeable right away. And also, as a reminder, we want to, as we're talking about infectious disease, and we're going to do it in a way that I don't want this to be spooky or scary. It's not. It's something that just is. It's just the things that we're dealing with in agriculture, and really understanding that power is knowledge, and we have the power to keep ourselves healthy and safe as we do the jobs that we love. I start off with this slide not only because we're flying. I know many of you may be in Illinois or other surrounding states, but we're flying our Nebraska flag here with this picture, and this is one of my family, and I love it because it reminds us that right now about 28% of our producers now are women. So as we talk about farming and farm injuries and prevention, we need to keep in mind that we need prevention for all genders. And a quick disclaimer: this material was produced under a grant with OSHA, the U.S. Department of Labor. It does not necessarily reflect the views or policies of the U.S. Department of Labor. Nor does it mention of trade names, commercial products, or organizations imply endorsement by the U.S. government. And then just as a reminder to all of you, as an employee, you are entitled to safe and healthy working conditions, fair compensation for all of your hours worked. You have the right to report unsafe conditions without retaliation. And of course, if you're an employer, you are responsible for providing a safe workplace free of known hazards. And just a little bit, and Salah did a nice job. Thank you for the introduction again. I was a researcher for many, many years, about 27 years. I researched tuberculosis and leprosy, periodontal disease, cancer, and then most recently pesticides and nerve agents as related to those effects in the Army and our armed forces, and as well as those that work with pesticides in agriculture. And then most recently working in farm injury and fatality prevention. I am considering myself an ag safety and health outreach person and love big horses. We were hog farmers for about 17 years in the Front Range of Colorado. Had a farrow to finish operation. So I know about some of the hazards very closely. We raised 3 boys on that farm, and boy, we were very fortunate that we raised them without significant incidents, which was really miraculous. We had a cow-calf operation, and importantly, I am a grandma. So our center is located in Omaha, Nebraska, called the Central State Center for Agricultural Safety and Health. We're located in the College of Public Health at UNMC, our medical college. We are funded by the National Institute of Occupational Safety and Health, that is NIOSH, and we are one of 12 ag, forestry, fishing safety centers. So we are charged with prevention, education, outreach, and research into all things ag, safety, and health. And we are certainly here to serve the ag community, and would love to have you reach out to us for any of your ag, safety, and health needs. So today, in our very short time together, we're going to have a few little things that we want you to take home, and one of those is you're going to walk away being able to define what an emerging disease is. You'll identify causes of emerging infectious disease in ag settings. You'll understand how infectious agents are transmitted to and between humans, and of course with animals in the mix there as well. We'll also discuss simple solutions that can be implemented into a risk management plan, or if you are an employer, into your business plan. So we all want to start off with the same terminology. So going back to your high school biology days, defining some of these terms. A pathogen is an organism that can cause infectious disease. So we're going to be talking about a lot of pathogens today. Contagious just means an infection from one person to another. And when we talk about zoonoses, or a zoonotic disease, that is the spread from one species to another. So contagion is from human to human, and zoonotic is from animal to human or human to animal. An epidemic. So that's when we're talking about an outbreak that is actively spreading, and it has the potential to become a pandemic. So when you remember back, and we can always use COVID as a great example. When we first heard about COVID spreading in China, it was termed an epidemic because it had not spread beyond that region. Once it spread, an epidemic of an infectious disease that spreads across a large region then is considered a pandemic. So we know very well that COVID became a pandemic very, very quickly because of the route or the speed of infection of that virus. And now endemic, and we are going to talk about particularly one endemic infectious disease today. And endemic means it's kind of here to stay now. Once you it has been established, we know it becomes predictable when it's endemic. Like our influenza, we know every fall we have to get our vaccine because we know influenza is going to be coming. Same situation now, I believe, with they're considering COVID endemic, and we'll talk about some other diseases that we find in agriculture that may be considered endemic now as well, instead of an epidemic or pandemic. So it's here to stay when it's endemic. So what's an emerging infectious disease? And I really love this visual, even though it's a little bit old, but it's when we have an infectious disease that's newly appeared in the population, we call that an emerging infectious disease. If it's left, but it has it's existed somewhere else, but now it's in another region or a geographic range, it's also considered emerging infectious disease. So you can see re-emerging and emerging. When you look at this, the newly emerging are kind of the red, well, not kind of, they are the red dots, and the blue are the re-emerging or resurging emerging diseases. And then the black is a deliberately emerging. That means someone actually started that, it was deliberate. And in this case, the one that we see there is anthrax, and that was because of a bioterrorism event. So you can see that, the U.S. has quite a few emerging and re-emerging infectious diseases. We're going to talk about a few of these because not all of these are related directly to agriculture, but some of them certainly are. So we know that about 70% of human emerging pathogens come from animals. That's a high percentage. So we know that this is a zoonotic type infection. Most of the pathogens are viruses, but new pathogens can also be bacteria and fungi. You can see a whole range of animals there. So here's your first polling question. Influenza costs U.S. businesses how much each year because of lost time, productivity, and healthcare costs? Just guess, make a guess. 21 million, 500 million, or 21 billion? We'll give you just a few seconds here, or a few seconds to make your choice.
It's such an interesting question. I have to say, before working on this grant, I never even thought about that influenza actually cost U.S. businesses anything.
Yeah, absolutely. Okay, looks like we had about 70% that chose 500 million and 30% that chose 21 billion. And I think, that's always a pretty good guess to go mid-range. But I will tell you, as we'll see here in a moment, it is 21 billion. It is a phenomenal cost to our economics. Let's move on here. So why are we discussing emerging infectious disease in agriculture? Good question. So we know as of 2020 that what we're showing here is the top 10 causes of death. And in 2020, not surprisingly, COVID-19 was the third largest cause of death. But what we also know, and it always within the top 10, are chronic lower respiratory diseases, influenza, and pneumonia. And COVID is still up there as well, even in 2023, but it has dropped a few places. And so we know that of the top 10 causes of death, 3 of those causes are infectious disease. So that is enough information for us to put a great emphasis on preventing these diseases. So the economic cost of influenza, which you took your poll on, we know that in between 2017 and 2018, we had 25 million people sickened, workers sickened. We had, if we calculate out at about a $26 average hourly wage, that's going to cost the employer themselves about $855 in lost wages, missing 4 8-hour shifts. And if you do the math on that, the estimated losses are $21 billion. Then when we look at the economic cost of COVID-19 in 21 and 22, workers' pandemic-related absences, and this does not include 2020 when we saw the height of this, it was more than $78.4 billion, or nearly $1 billion each week. And that's was calculated from disability wage payments, state disability insurance, and sick leave wages and employee. So you can see any way you look at it, it's a huge economic loss, not only to the businesses, but likely to workers themselves who may not have the time off, and maybe even, in which we saw quite a bit, people going to work sick because they couldn't afford to take the time off. So very simply, when we have healthy workers or a healthy workforce, we are going to have healthier communities and healthier industries. And when I say healthy, that's not just economics. It also means you're going to have your workforce that's just going to be a healthier workforce. And by maintaining a healthier workforce, we're going to lower direct costs such as insurance premiums and workers' compensation claims, and have a direct impact on costs such as absenteeism and worker productivity. And these have all been proven. You know, when we know a sick employee just is not going to be working as well. As you know, and if you're self-employed, if you're in the ag industry and you have to get out there and do that work when you don't feel good, that is a hard ask. So we're going to figure out how to keep ourselves healthy. All right, here's our post poll. Let's see if y'all were listening. Influenza costs U.S. businesses how much each year because of lost time, productivity, and healthcare costs? I'll give you just a second to fill that out. Look at you guys go.
It really does help us when you fill out these polls, because we can go back to OSHA Harvard and say, hey, yes, they are learning.
Yeah, they were listening in. So we appreciate you taking a moment to fill those out, and we'll see what our results. All right, very good. 67. We turned it around there. So 67% of you realized or learned that it cost $21 billion. Influenza is going to cost us about $21 billion to. All right, we are going to now talk real quickly about the 4 types of infections: bacteria, virus, parasites, and fungi. Bacteria, we'll start off with found throughout nature, usually a single cell organism. That just means that even one organism can cause disease. People and animals carry millions of these on your gut, on your skin. Those of you who have taken a course of antibiotics may have had some intestinal problems after that, after taking your antibiotics, because you've actually killed off some of the bacteria that's essential in our guts to help with digestion. And those are called commensal bacteria. Those are ones that we need, that are good. They're great to have to assist us with our digestion or on our skin to protect it from other organisms. So your doc may have prescribed yogurt, something that has some of these organisms that can repopulate your gut. So we know that most bacteria are harmless and many of them are beneficial. Only about 1% are pathogenic and cause infectious disease. So very few bacteria. They may be treatable with antibiotics. And here's where I always like to remind everybody, we go into our doctor and we're feeling absolutely rotten, but they determine that it's not bacterial disease or infection that's causing our sickness. It's likely a virus. They are not going to give us antibiotics for that, because antibiotics do not cure a bacterial infection. So if they think it's bacterial, you may get antibiotics, but otherwise, if it's viral, they will not be prescribing. And some bacteria are controlled by vaccinations. Some are contagious, and we're going to talk about some of those. And then just keep in mind here too, respiratory infections are the most common fatal bacterial disease. So in agriculture, that's really important, and we're going to find out a little bit more about that in a moment here. Some of the bacteria that we find in agricultural settings include anthrax, bordetella or whooping cough, and Lyme disease. We're going to talk a little bit about ticks here today too, because we're coming into tick season, and that bacteria is transmitted by the bite of a deer tick. Campylobacter, food poisoning, Clostridium, also another food poisoning. So here we're talking about a few that maybe if you were not in agriculture, we would talk about maybe food safety, but in agriculture, we may be getting these directly from the animals, not from processed meat, but from the animals themselves. Same with E. coli. Anybody that has raised calves knows that when you walk in that barn, if those calves have E. coli, you know it immediately from the smell. And so we know that this is something that if we even suspect that our animals are infected, we need to be taking extra precautions. And that includes, if you're working with those calves, wearing gloves. Mycobacterium or tuberculosis from unpasteurized milk. Salmonella, once again, another food poison, but also comes directly from our animals. And that can be not picking on calves, because you can certainly get it from hogs and chickens as well, but that is something, especially in the dairy industry, we have to be especially careful about. Shigella, once again, in recreational water, contaminated drinking water. We're going to talk a lot about taking care of your water too, and coming from feces. Vibrio in raw and undercooked shellfish. And then the plague. We just had a report come out of one of our western states. Cat became infected, and then the veterinarian, I believe, that was treating that came down with the plague as well. Those of you out here in our country, we have prairie dogs, and we know that they are a host for fleas with the plague. And so we really have to talk to our ranchers about being careful if they're poisoning or if they're shooting these prairie dogs. They have to take care when they're collecting them, unless they're just letting them lay. Bacteria in our ag settings can be spread to us through soil and dust. Rodents, as we talked about a second ago, livestock, human to human, and then through our water, and of course food. And so food safety always comes into this as well. So another fun poll. This one is: emerging infectious diseases in agriculture include and select one of the following. So is an emerging infectious disease in agriculture E. coli, aflatoxin from mold, the Heartland virus from ticks, or all of the above?
Yeah, this is a tricky question. Let's give them a few more minutes, or a minute or so, to answer it. I'd love to see everybody's responses for this question.
All right, about 64% of you got it correct. All of the above, that's right. And we're going to touch on each of these because each one of these is actually considered an emerging infectious disease. All right, let's start off with this one. E. coli 0157, or enterohemorrhagic E. coli. This is, you can become infected from undercooked ground beef or raw milk, and it can be passed directly to farmers and ranchers from the stools of young calves and adult cattle. It's not just those calves. And then once we have contracted it, we can also spread it from person to person, and that's usually through fecal contact. So that's when someone is not being careful about their sanitation. This is considered an emerging bacterial disease because they are seeing more of this in our food sources. So this isn't a food safety discussion or a presentation, but always be aware of when you are cooking or working with ground beef or raw milk to take extreme care to wash off those countertops and make sure your hands are clean. So MRSA, or methicillin-resistant staphylococcus. Some of you may be familiar with this because of hospital stays. It is something that is rampant in some of our hospitals. It is highly antibiotic resistant. It's a strain of staphylococcus or staph that came from hogs and has since infected humans. And so having raised hogs myself, I know, there's a lot of times when we're knee deep in some of this stuff as we're cleaning and moving these animals, and really taking extreme care to with our sanitation after working with any livestock is essential. But we know this is one example where it has jumped from the hog population to the human population and is causing quite a bit of issues, especially in our hospitals. Pertussis, I added this simply because we know it's not necessarily an agricultural issue, but we are seeing a resurgence in whooping cough, and has been over the past 25 years. We really thought that we had pretty good complete vaccination for a while. Now that folks are choosing not to vaccinate, we are finding that this has become more of an emerging issue, especially in our elderly and our very young folks. And as we age, our immune system isn't getting any better, and so we do see that this is something. Some of these emerging infections and infectious disease itself, whether it be emerging or not, those of us that are older or the very young are most affected. Viruses are submicroscopic infectious agents. They're just absolutely, I've always been fascinated by viruses. Here you have just a bundle of DNA and some carbohydrates, and some protein that don't even need to be able to reproduce on their own. They are able to invade our cells, the cells of our animals, and use our cells to multiply. They infect all life forms, and they're found in most ecosystems. It's hard to get away from viruses. So infections, most of us can know very well what a viral infection may feel like. It feels like the flu. If you've ever had the flu, a lot of these other infections are very common to that as well, with fever, chills, body ache. We just feel rotten. We're tired. It's hard to motivate and even work if you have a viral infection. There are some antiviral agents. Some of these have been developed actually because of COVID, and are pretty effective if taken immediately upon diagnosis. But once again, as a reminder, we're not going to use antibiotics on a viral infection. And there are vaccines for some of these viral infections. Some of those viruses that are found in nature include the hantavirus. We're going to talk a little bit about that here in a moment. And that comes, we are infected because of rodent exposures. Influenza, both poultry, swine, cattle, and other workers can infect us with influenza. The West Nile virus from mosquitoes, and I don't know, I should have looked this up, but in your region in Illinois, I don't know if you have Zika yet, but we had our first case of Zika a few years ago, and that is a virus that is spread by mosquitoes and can cause great harm to fetuses. So we are very concerned about the Zika virus as well. The coronavirus, of course, we know a lot about that now. Heartland virus, that is another virus we're going to take a moment to talk about, because this is something that is truly an emerging issue. And I did a little research, and Illinois and surrounding states do have the Heartland virus tick now, the Lone Star tick carrying the Heartland virus. Flavivirus from insects, norovirus from hogs, cattle. You can get the norovirus once again, primarily through fecal contact with other workers. Hepatitis E from meat products. And then rabies is a virus that we're all pretty familiar with from other mammals. And rotavirus is one of our waterborne viruses that we're going to talk about here in a sec. Our viruses are spread to us as humans by insects, through rodent exposure, birds from birds, livestock, other livestock, human to human, and water. So very similar to what we saw with bacterial spread. Avian influenza. And I really want to touch on this. I don't know if any of our participants today are raising poultry, but this is something that is of great concern, not only to our poultry producers because of the economics, but to the medical community because of the concern that this could jump into the human population. And so we know that between 2022 and 2023, there was another outbreak of avian influenza that affected not only our domestic poultry, but quite a few of our waterfowl and our raptors and some of the shorebirds in the US and throughout Canada. I did I did look here. It seems like Illinois has not had as many of the as much of the outbreak affected as some of the other states. We are in kind of a flight zone here in Nebraska, so we've dealt with this quite a bit. But this is one of the infectious diseases that many experts are considering now to be endemic. That means that probably here to stay, and that we will have to deal with this on a yearly, or if not yearly, throughout the whole year basis. And so it may involve some of our poultry producers, other than biosecurity measures, maybe having to look at some vaccinations for the birds and things like that. And of course, as looking at it from a public health lens, we really want to keep our workers safe from these birds that are infected. This current strain, which is known as H5N1, causes huge loss in poultry, and it is highly pathogenic, and that's why sometimes you'll see it called HPAI, which just simply means highly pathogenic avian influenza. Over 52 million birds were euthanized in 2022. Few less than that in 2023, but I think between the biohazard measures that a lot of these poultry producers have put into place, and better tracking of this influenza has helped our producers quite a bit reduce some of those deaths. Here's another virus that, I don't think it should keep you up at night, but I would love everyone to be very aware of and spread the word. As of November 22, more than 60 cases of the heartland virus disease had been reported. This is a new virus. This had not been seen before. It was first reported in Missouri, and it was reported in agricultural workers. And that kind of makes sense. We're the ones who are out in the fields, we're out there, where these ticks can actually latch on to us. Most people were diagnosed with the disease between May and September, which makes sense again, kind of tick season in the Midwest, and were diagnosed with doing outdoor work. And you can see the spread there, and that is a fairly recent map. Another emerging infectious viral disease is influenza D. This just came out in March of the 2023, so it's about a year old, this news, but it was for the first time found in cattle and their handlers. And the report stated that no one knows yet if influenza D causes any symptoms in people, but they indicate it's likely to be called an emerging virus. So it's jumping into people who work with animals, such as dairy farmers, but not likely to spread much beyond that. So we've seen that this move from animal to human, but luckily not human to human, and they have not seen significant or bad symptoms yet in our farming community. But something to be on our radar. So COVID-19, what we know, right? It spreads rapidly. It spreads through droplets, spray droplets. The symptoms can range from almost nothing, like you don't know you have it, to severe. Your symptoms are going to appear about 2 to 14 days after exposure. You can be contagious before symptoms show, which is, one of the dangerous things about these viruses. You may not feel sick, but you're still infecting others. And then most contagious when you're most symptomatic. And that makes sense. If any of you that have had COVID know that as you're coughing and you're blowing your nose, and that is when you're going to be most infectious, simply because that's how this is being spread, is through your body fluids. And then we all found out that this is the highest risk for severe illness is in our elderly and those with health conditions. And that would include heart disease, lung disease, diabetes, and suppressed immune systems. And the good news is we know that best practices can help reduce the transmission of this virus. So when we look at flu versus COVID, the SARS-CoV-2 virus that causes COVID-19 is known to be much more infectious. And you saw that on that graph that I showed earlier about number of deaths. It's just not only is it more infectious, but the symptoms are much more severe. Spreads faster than influenza, causes at this point more deaths and hospitalizations. Of course, we're not fully vaccinated, so that may change. And then COVID symptoms can be much more severe than the flu. And of course, we know that the flu influenza, or you do now know, the flu vaccine changes every year. So the manufacturers kind of watch it as it emerges in Asia. They look and check that out, and that's how they make the vaccine that we receive, is by what the antigens, or what that virus is made up of when it's first detected. Then they use that information to make the vaccine that we receive. So it is changed every year. Parasites, we know that they use other living things like your body for food and a place to live. This is a wonderful visual, isn't it? They range in size from tiny one-celled organisms to worms that can be seen by the naked eye. So we know, we've all probably seen parasites if we have pets, and we know that they some of them can be visualized easily. They're found in agricultural settings. Some of those that we will see directly related to agriculture are Cryptosporidium parvum, or crypto, known as crypto, Cyclospora. We'll find that in our water sources. Entamoeba histolytica, or amoebic dysentery, once again found in our water sources. Giardia. Now, if we were in person, I would ask you, how many of you have had Giardia in your lifetime? And I can tell who you are, because your face is going to crumple up and you're going to kind of raise those shoulders to your ears, because it is an absolutely miserable infection to have. Our family was affected by a contaminated well, and if you can imagine 5 people all sick as can be for quite a few weeks, we will never forget that infection. It is the most common parasite in the U.S. We're going to talk about water here, like I told you, and it is so important to get those wells tested. Leishmaniasis, malaria from our mosquito transmission. Malaria, we thought, well, we did not have many cases of malaria over the last 50 years. And once again, now with some of our temperature changes, we're seeing some malaria, specifically in our southern U.S. right now. Blood flukes, tapeworms, really affecting our animals, but can also infect us, and trichinosis. This, once again, spread very similar from soil, from our livestock, our animals, our pets as well, insects, through water sources, through food sources, and then through blood contamination as well. So an emerging parasitic disease is Cryptosporidium parvum. This is a leading cause of very, very dangerous diarrhea in many developing countries, and it's now a threat to the U.S. water supply. Our cattle serve as a major host of this particular parasite, and you can see the life cycle there from cattle infestation. It may be feces that was in the water source. We then swim in that source, or we drink some of that water. Those oocytes, or the cells, get into our intestinal tract, and then we actually will pass those back out and start the whole system over again. So a big problem. We need to break that cycle as fast as we can. And I remind everyone once again, if you have a well on your property, please go home. Do not drink another drop of that water until you have that well tested. Let's talk about fungus. There are millions of fungal species, and fortunately for us, only a few hundred of them will make us sick or infect us. Molds, yeast, mushrooms, or all types of fungus. Some of the diseases caused by fungus in ag settings. One of those is aspergillus. And this mold causes what's called aspergillosis, and it's very common in grains, grasses, and hay. And this is a reminder when you are working, whether you be in a barn or outside, if you are working with hays, whether you're putting up hay or whether you're feeding and some of that hay has mold on it, do not be breathing that. Make sure you are putting your N95 respirator on. Slip that on as you're using that, as you're feeding that hay or working with that hay. Breathing aspergillus spores can cause an infection in the lungs or sinuses, which can then spread to other parts of the body. And this can be cause quite severe disease if it does spread. Ringworm. Throw this in there because it is caused by a fungus. Anyone can get it. It can live on surfaces and skin, on household items such as clothing, towels, and bedding. We can easily contract it from cattle, horses, sheep, hogs that all transfer it to the handlers. This is not something that is going to cause severe illness. It's an annoyance and can be treated. But just to make you aware that if you do see your livestock with ringworm, to treat that ringworm and use gloves around those animals to prevent infection. Histoplasmosis. This is something that we really are talking a lot about in our center. We have a lot of new poultry farmers in our region, lots of new poultry barns going up, and we understand the importance of getting this information out to those that are, especially those that are going to be around poultry droppings, bird droppings, bat droppings, any place where you are going to have especially bird and bat feces, you are likely to find this histoplasmosis. And the visual we show here has it going in through the nose or the mouth, but it also can be quite a severe disease if it gets in your eyes. So as you are cleaning those barns, cleaning those bins, any place where you may have had birds, bats, especially if you're cleaning your poultry facilities, make sure that you are protecting those lungs, the eyes, which will go directly to your blood and into your lymph system. So we want to make sure that we are keeping the histoplasmosis out from all routes of our body. Mycotoxins are compounds that are produced by certain types of molds. One of them that we are especially concerned with is aflatoxin. This is a known carcinogen. Here's a picture of what it looks like on our corn crop. This, when our corn, and I don't know how much problem you've had in Illinois. We've had quite a bit of problem especially in our southwest Iowa and parts of Nebraska, where we had drought and then we had a big rain, and this fungi just goes crazy, and then it creates this aflatoxin in our corn. It does cause quite a few problems: red eyes, headaches, nosebleed, rashes. But my biggest concern is it is a carcinogen. So as you're blowing out your filters on your tractors, as you're working with out of condition corn in your bins, if you're cleaning your bins out, make sure that you are protecting both your eyes and your respiratory tract. All right, so here's the post. Here's you've seen this polling question before. Here it is again. So an emerging infectious disease in agriculture includes all, or select one of those, all of the above: Heartland virus, aflatoxin, E. coli. What do y'all think?
And as we give them a minute to answer this, and for the Heartland virus, do you know what the symptoms are when you get it?
Yes, it is. It is, once again, flu-like symptoms. People will get severe headaches. They'll have fever. They'll have fatigue. And so it may feel like influenza. We're going to talk a little bit here in a minute about what you do if you find a tick on you. It's very important nowadays that you don't just throw that tick away. You're going to keep that tick, and you're going to try to remember, if you do get these symptoms, to take that tick with you to the doctor, because they can test that. All right, what does our results look like? Y'all, excellent, excellent work. 100% of you got that. I love it. Thank you. How do we get these infectious diseases? This is a great visual, but we could also, instead of the infected person over on the left side of the screen, that could be an infected animal. Of course, you're not going to be kissing your animals if you look at the, well, let's not kiss our animals. But if we touch that animal or we touch that infected human, we can become infected. Of course, we know droplets from our mouth into the air, into our respiratory tract. We have direct contact. We may be touching that animal. We may be vaccinating it, moving it along, whatever. Once we touch it, if it is infected, we are now infected as well. By food, insect infestation, and then, of course, the animals. So this is a pretty good visual, right? Droplets, a spread. We get those from our mouth, from our nose when we cough or sneeze. Remember how we were supposed to stay 6 feet apart? Well, that's because the average droplet travels about 3 feet. If you are a 6'4" man who weighs 250 pounds or 275 pounds, your droplets are going to travel a little further. So stay away from those folks that are a little taller and weigh a little more. Transmission is infected by being inhaled by other people, may get in our eyes. Remember, our eyes are an excellent way to get things into our bloodstream. May land on surfaces and people touch them. And examples of this are influenza and, of course, COVID. You may get transmission through an insect bite or an animal bite. That goes directly from the saliva of that organism into our bloodstream. Examples of these, of course, are rabies, West Nile and Zika, and the Heartland virus or ticks. Contaminated water. Here I go again, right? Contaminated wells, stock tanks, and farm ponds can all be infected with all those organisms that we talked about earlier. Some very classic examples are the E. coli, rotavirus, or Giardia lamblia. Those are called coliforms. So when you have your well tested, you may see on there what they are going to test for, and those are fecal bacteria. So they're going to test for fecal bacteria and some other things when you take that water in. And just, if you go to your health department to have them test that, they can also help you with cleaning up that well. Animal feces transmission, here's where that hantavirus is really a huge problem. We have ingestion of the dust or water containing feces from rodents or livestock, that cause viral or bacterial disease. So we have some examples of respiratory disease, and one of those is the hantavirus. This is transmitted directly from rodent urine and droppings, primarily, and then you go in that barn and you clean that up without a respirator on, you get that in, and you are infected then with the hantavirus, with symptoms including, once again, fever, chills, headaches, muscle aches, vomiting, diarrhea, and abdominal pain. Very few deaths, but we do have a lot of symptoms that go along with that. Vectors such as ticks, mosquitoes, lice, and fleas transmitting between humans and animals to humans. So when we think about that, we usually think about those that are actually blood-sucking insects, such as the ticks, mosquitoes, lice, fleas, and they ingest the disease-producing microorganisms from a host, such as a bird or an infected, say a prairie dog, and then transmit it directly to us as they bite us. Surfaces are always something we need to be concerned with. If we touch it, someone before us may have touched that, or if we're working in a barn, an animal, of course we know about animal spread as well. All right, here you go. This is, we're getting done with our polling here. What is the #1 way of preventing the spread of infectious disease? And is it to wear a mask, to avoid your coworkers, to cover your cough, to wash your hands? Which one of those do you think is going to be? They're all, I'm going to give you a hint, they're all good ways, but what is the number one way to prevent spread of infectious disease?
Yeah. No, thanks for sharing so much information. After presenting all the diseases, I can't help but Ellen feel like very super paranoid on.
Yeah, well, we don't want you to do that. We want you to feel empowered, not paranoid. Oh, I love it. Most of you knew that, 90% of you knew that washing your hands is going to be the number one best way to prevent that disease. Very good. All right, let's look at this. Hand washing, most effective way to prevent spread of infectious disease. And here's a whole list of great ways to, great things to remember. And we know all of these, right? We can understand these. It's just remembering to do it. And we're going to give you some great tips here in a minute to help. If you are an employer, or even if you're not, some great ways to prompt folks to wash their hands. And here's just a little reminder that to wash those hands at least 20 seconds. That friction is extremely important for removing the infectious agents. And if you don't have soap and water, use at least 60% ethanol sanitizer. Here's something I absolutely love, and it's only $80. And this is really a great idea for those of you that may have a lot of folks working in a barn that does not have currently have a sink with running water. This you can put out there. You fill that basin with water. They use the foot to pump the water, and you can add soap to it. And it really is one great inexpensive method to get folks to wash their hands in places where they don't normally have access to soap and water. I would love to have you send me, this is kind of like Oprah. Everybody gets a hand washing poster. So if you just simply email me at ellen.dysen@unmc.edu, I'm going to, and give me your name and mailing address and how many laminated posters you'd like. I'd love to send these to you to put up in your workplace or at home. If you think some of your kids may not be washing their hands, you can just put it on the mirror there to remind them. And then always have to talk about masking. Protect your lungs by wearing a NIOSH approved 2-strap N95. And what that means is a good respirator. Don't use a 1-strap respirator. Use something that has been approved by NIOSH. If there is dust in the air, it's probably good practice to put that respirator on. And if you, a coworker or family member, is showing signs of respiratory infection, if you don't want to wear one, ask them to wear one. Keep a good supply if you're an employer, or if you're working in agriculture. Keep a box of these in your truck behind the seat. I know my husband does that, and it really has helped prompt him when it's handy to have these respirators. And if you do, you can use them for voluntary use if you are an employer during flu season or for dust exposures. Let's talk about immunization real quick. Important stuff. We know that influenza, we are asked and recommended to get a flu shot yearly. Tetanus, about every 10 years. Hepatitis B, depending on where we're working. The shingles vaccine for those of us of a certain age. COVID, we're going to follow CDC's recommendations on that one. And then others, depending on our area and travel. There's actually now even a vaccine out for tick exposures, believe it or not. So stay current on those immunization and vaccines. For employers, here is an absolutely wonderful idea. Help your work, take that barrier of I don't have time to do it or I forget about doing it, and bring vaccination directly into your workplace on company time. And you can do this very, very simply by engaging your local health department. They will love it if you do this. Invite your local pharmacist to come on site. Make it an easy, optional process. Make it a simple decision. And I guarantee your insurance company will love this too. Drinking water. Let's check those wells yearly, at least yearly. You're going to check them even more frequently if you found that you do have an issue. If you have to shock your well with chlorine, go ahead and test it again in a month. We're looking for those fecal bacteria in there, but we're also looking for nitrates. And although not an infectious disease, as you may know, it is important to check for. And then everybody just needs to follow their local public health department suggestions for how you're going to get rid of the bacteria. And then you may need some filtration if you have high nitrate levels. Easy to do. Then properly dispose of those sharps. Make sure that, if you do have folks who are in your family, in your ag business, in your industry, that are taking regular injections, maybe for diabetes, that you provide them with a sharps container. If you do need a wonderful approved sharps container, once again, put that in that email to me, and I'm going to send you one free of charge. You can see here what you don't want to use, something where those needles may penetrate. And please do not recap needles. After you treat those animals, just throw them directly into that, because needle sticks are a great way to become infected. Dispose of your infectious waste, make sure that we've got a great place to do that. If you have a spot where people know that they can throw their personal waste, that's where they're likely to do that. And then for ticks, mosquitoes, fleas, make sure that you check after you've been outside. If they're embedded, please remove that, put them in a sealed baggie, mark it with the date. If you do become ill, if you get a red ring or you have a fever immediately within a few days after that tick exposure, embedding, not just exposure, if they're just crawling on you, you don't have to put them in a baggie. But then you can take that tick with you to the doctor and provide repellent for the workers in the field. Use your PPE to reduce infection spread. If you are an employer, please provide access to PPE so they're not having to buy it themselves. And that'll take one of those barriers down. And it's going to pay back on having those folks there when you need them and not sick. Provide the PPE that's appropriate to the hazards. Train your employees how to put it on and take it off properly. There's lots of great videos, including on our website, on how to do that. Train employees to maintain and store and replace their PPE, and provide medical evaluation and fit testing if necessary. So we need gloves to protect us from germs on surfaces. If you're treating those, remember those calves that had E. coli, wear those gloves. Respiratory, protect spreading of inhaling droplet spray. We're going to use a really good approved mask. And then we're going to have glasses or shields if we have infectious particles entering. I would love to see everybody, when they're cleaning out their bins, have a great pair of safety glasses on or a shield. And this is just a visual about how, disease, we were talking specifically about in agriculture, but there's going to be lots of contacts throughout our communities too. Our kids are going to be getting infected at school when they're transporting to and from school, while we're socializing during worship, and that disease is going to come home and eventually come back to work with us. What's the number one way to prevent spread of infectious disease? I bet you all know this one now.
Yes.
Yeah. I'm betting on this one. And it's such a simple thing, isn't it? Oh my gosh, look at that. 100%. Y'all are just brilliant. Appreciate it. So we're going to break the cycle of infectious disease in our families, at our schools, workplaces. Many may become sick from a single event, but let's reduce the infection and not share those germs. So sick workers, stay home. That is so, I know it's hard. We need to be a culture that does that. Use masks when in contact with others who are sick, or if you are sick. Frequent hand washing or hand sanitizer, avoiding close contact with those coworkers and customers, especially during high flu season. Cleaning and disinfecting, and maybe avoiding handshaking. I know that's hard, but I'm doing a lot of that. I'm back to that elbow bumping thing. And I want to thank you all for hanging with us, and thank you for protecting our most valuable asset, our workers. And we did this training in collaboration with the Grain Handling Safety Coalition and the University of Illinois Urbana-Champaign. And please, please reach out if you need more resources or training. It's all free. And I'm going to turn that over to you, Sela.
Thank you very much, Ellen. Thank you for coming, giving this great and very important presentation. We have a lot more coming up, so we're going to focus in March on grain entrapments, then in April on farm worker safety and health, and then we have a really great presentations coming in May on how technology will shape the farm of the future, also from a safety and health perspective as well.
Excellent.
So this is farmdoc has been a great partner in this and developing some of our slides, making them pop out, and they could not do it without their sponsors. So thank you to all the farmdoc sponsors. Also, thank you to the educational partners for farmdoc, which is our College of ACES and the Department of Agriculture and Consumer Economics and Extension. So thank you for joining us. This will be archived on YouTube, so you could definitely go in there at any time and check out the farmdocdaily.illinois.edu. And lastly but not least, I'd like to thank our partners at Grain Handling Safety Coalition and the Central State Center for Ag Safety and Health. They have a lot of different training programs that they conduct. Please feel free to visit their websites and check out what they do. And if anybody has any questions at this moment, I'd love to answer them. Or Ellen would probably also love to answer them.
I would.
And it seems like we're at time, so we'll just call it a close. But please, you have Ellen's contact information. Do contact her if you want any material, you have any questions, which is an awesome resource.
Well, thank you. And thanks for this opportunity. Appreciate it.
Thank you.